Hello, my name is Yudi and this is the Yudi Factor. Yudi Factor is a program that understands that knowledge is power. And therefore, week after week, we will be discussing programs that will empower you with so much information to enable you make informed choices when you factor in something you've heard on the Yudi Factor into your situation. Today, we are talking about the aging eye on our series, Aging Gracefully. I have with me Dr. Femi Oderinlo, the Senior Consultant, Eye Foundation, who is my guest today to discuss the aging eye. But before I introduce him, I will tell you a small story. I used to pride myself of having a 20/20 vision. And then after I turned 53, I was flying from Frankfurt to Boston. And I was given the immigration forms to fill, and I couldn't read. And I beckoned on the air hostess to help me fill the form. And she said to me, "Madam, you can use my glasses." So I said to her, I don't think I'll be able to see anything. And then she gave me her glasses, and boom, the letters came out alive, and I could feel the form. That was when it dawned on me that the aging process had started assaulting my eyes. And when I landed in Boston, I told my daughter to take me to an ophthalmologist. And that was where I got these glasses that I now call my never leave home without. So, my guest, Dr. Femi Oderinlo, what happened to me? Insult of aging.
Well, it's one of the first things that age introduces itself to you. We call it presbyopia, and it's a change in the accommodative amplitude. If you were to take a picture of something close to you, and you want to take a picture of something far away, and you are using a camera, you will adjust the focus. Now, we don't adjust anything on our temple to get to focus, because there's an automatic mechanism in the eyes that changes the focus, and that's what we call accommodation. But as we move towards the age of 40, we begin to lose accommodative amplitude. And the first thing you notice is that you start pushing the book forward. Interestingly, some of my friends, when they come to tell me I'm not seeing well, and the next question is that, do you push the book forward? They say yes. They say, how far do you push it? See, like this. Okay, then I can guess you've lost one diopter. Because the further you push it, the more accommodative amplitude you have lost. And actually, by understanding and studies, we found out that at the age of 40, you lose like a diopter. At the age of 50, about 2 diopters. 60, about 3 diopters. So it's as a result of certain things that go on. The mechanism is actually 3 basic things that happen. The lens itself changes in size and position, and then the pupils constrict. And these 3 things help you to be able to focus closely. But because the lens is not as flexible as it was when you were a child, then it's not able to automatically change. And those are those things that now reduce your reading. The solution you were given, your glasses.
Is it a process that we, the senior citizens, is it a process that we must go through? Because there's some people I know who are in their 60s who don't read with glasses. Why is that? Is it that their eyes never age, or what?
Interestingly, if you're about 65 and you don't need glasses, the most likely thing that has happened to you is what we call the second sight of the elderly. And that also has to do with your lens changes. The lens gradually becomes more short-sighted. The reason is that over the years, the fibers that are formed in the lens, they form from the sides, and they push to the center the earlier ones If a lens fiber was formed at the age of 10, 11, another one forms like that. By the time you are 50, you will have had, let's say, 50 lens fibers. Yes. And they will push, because the space, your head is not going to expand, so the space has to still contain all of them. So they push the earlier fibers to the center, and that develops a sort of nuclear sclerosis, a sort of thickening, and that increases the myopic strength of your lens. So many people, if at the age of 65 you are not using glasses, it's likely that development has happened in the lens. Again, we have to look at, we are quite different.
Yes.
We have different, the size of our eyeballs vary. So some people are actually short-sighted. And if they are short-sighted, they have an advantage for near. They can read. Whereas other people are relatively far-sighted. And so they see distant things better and have challenge with reading. So you cannot directly compare yourself with someone else. Even if it's a close relative, a sister, your child, you don't basically have the same refractive makeup. There are so many other things that contribute to that. The cornea, the shape of the cornea. Some areas, the eye is not a ball, it's oval. So there are some areas that are steep relatively than the others. And all these factors come together to give a refractive character to the eye. And so different people have different needs. And a lot of people also say, my parents, our grandfathers never used glasses. And the example I always give is that my own, from my lineage,
yes,
they were hunters. And so probably all the man needs to see is a grass cutter running, and he can shoot it.
Yes.
And that's all. But now I need to read tiny things. So the demand for this generation is different from the demand of their generation. So we can't judge by the fact that they were not using glasses and we need to today.
Is it written down anywhere in medical journals that once you get to 50, you must have a need? Because the majority of the people I know at that age wear glasses. Can it be reversed? Is there anything one can do to reverse my not wearing this?
Well, these days, there's a lot of talk about refractive surgeries. And refractive surgeries, there's a focus on refractive surgeries for presbyopia. Some of them have recently been investigated. Refractive surgeries are best for short-sighted people who probably have a very high degree of myopia. We use numbers and diopters, so let's say something like a -8 diopter. Such a person sitting here without glasses may not even see your face very clearly. But you put on the glasses, the whole world comes alive.
Yes.
Now, refractive surgery can help you to be able to, it's just like the optics that this pair of glasses creates can be done in your eyes. But that does not take away the aging process that is going on underneath. Because a number of things goes on. First of all, the eyeball, most of the time, the eyeball grows all through life.
Grows?
Yes. So when you see a child who probably has, we call it the axial length of about, let's say, 20 millimeters, and because of that amount of, that size of the eyeball, he's relatively far-sighted. As the child grows older and the eyeball grows, and let's say it now gets to 23 millimeters, then suddenly he doesn't need glasses again. It's not the glasses that corrected the eye, but the growth of the eyeball, moving it more towards a normal sized eyeball from what it was as a smaller eyeball. Those are just some of the things. So as we live, I think aging is something that is programmed into our cells. Eventually, we will attain certain levels based on the changes that go on. But I just say you just be prepared for it and do some things that will reduce the effect of aging on you.
Hold that thought, doctor. Hold that thought. We'll be right back. Don't go anywhere. We'll be right back. You're welcome back. This is the UD Factor. My name is still UD, and today we have Dr. Femi Odorinlo, senior consultant, Eye Foundation, to educate us on the aging eye. What can we do to, first, for those of them who have not crossed the line yet, that's 50s, and are not using this, how can they maintain a healthy lifestyle that would keep their eyes sharp? For those of us who have crossed and are using this, what can we do to reverse it if it's not possible? What can we do in spite of the aging process to not worsen it?
I think there are good habits that you can keep that are very important for your eye health. Yes. These days there are a lot of screens, and people say you have the television screens, you have your phones, and one thing that has been documented is that when you are watching a screen, you blink less.
What screen is that?
Blink. Any
what
screen?
Any screen. Okay.
Any screen.
Okay.
A normal screen like the TV. Okay. Now, normally you will blink like 15 times in a minute because your cornea doesn't have a blood supply, and so you have to use your tears to clean it. So sometimes one way or the other, when we watch screens, we don't blink as often. So when you're watching a screen, you have to purposely remind yourself to blink. And also you have to take, if you're going to spend a long time in front of a screen, you should purposely take breaks where you, maybe 2 minutes, where you close your eyes, just purposely, so that you don't put your eyes under undue stress. And diet. A lot of things have been said about diet. A lot of the information comes from studies that look into some age-related conditions. One of them, age-related macular degeneration. And basically what they point at are vitamins A, D, E, and then they also talk about C, vitamin C, and then you have selenium, which are very small in small quantities. Actually, if you go around, you see a number of eye health
vitamins.
Yes, that basically contain vitamins and antioxidants, and in a number of studies they've been found to be helpful. The best actually is if you are able to eat a balanced diet, and you can make sure you get your vegetable, your fruits, your 5 portions of fruits in a day. All these things will help your body to be able to, because you see, part of what happens is that the repair process, the body makes new cells, gets rid of the old ones, and all this repair process, you need to keep them going at the rate at which they were going when you were younger.
Is that possible?
You will not achieve, it's not biologically possible. You will not achieve the growth rate you had as a child when you get to that. But you can help your system by giving the needed nutrients. And I also say you need enough illumination when you're reading.
Yes. There's so many people of my age who complain of dry eyeballs. Mine is at night, very dry, that it feels like my eyelids sticking to my eyeballs. Is that part of aging, that your tears cells don't function anymore, or what?
Not directly, but an association has been established. because again, one of the things is like someone who has been working for years, after some time, you tend to sort of slow in your pace. So yes, dry eyes are found more commonly in older people. It's not that it's a direct result that you grow old and you have dry eyes, but it's just that it's more associated with older people. And there are a lot of things, even over the counter, good medication, tear substitutes that you can use. For one, I noticed that whenever I go in an aircraft, because of the controlled environment,
yes.
So I always have tears substitutes with me, and just one drop in, if you were taking a flight for 6 hours, just do it 2 times. You find out you come out better, not having that burning sensation in your eyes, which is often associated with the eyeballs being dry. So you can do a lot of things. It also, in temperate conditions, in humid conditions, there are variations in the amount of tears that sort of evaporate from the surface of your eye. So you can do very well with lubricants, and they will help to reduce the burning. And see a doctor. It's also very important.
We've discussed the wearing of glasses. We've discussed the dry eyes. What other indignities do we have to live with?
Well, like one of the other things we just mentioned about the lens changes, which is worldwide, what we call cataracts, which is an opacity of the lens, is known as, it's actually the leading cause of blindness and visual impairment. It's age associated.
Okay.
Age associated.
Age associated. How about glaucoma?
Now that is will I say, the neighbor of cataracts. They live together. But yes, again, glaucoma is associated with age. In most public health definitions, you always look at the occurrence above the age of 40. It's said to be more common above the age of 40. It doesn't mean that there's juvenile glaucoma, and there are other types of glaucomas that can happen secondary after injuries and all this, but the primary glaucoma is associated with age. It's more common above the age of 40. And you see, the best things for this kind of a disease is to check your eyes. Because if you wait until the symptoms come, then it must have reached some level of advancement before you start noticing. Because believe it or not, we have like 1.2 million cells in our eyes, in the retina. And so by the time you're beginning to notice, you very well know if you have 1.2 million things and you miss 20 of them, you won't know. By the time you start knowing, you must have lost quite a percentage. So it's best to check your eyes. And there are tests that are quite sensitive and can pick glaucomatous damage early. Because whatever is lost to glaucoma, you can't get it back. So if you pick it early and you control it early, then you don't lose much. And you can now maintain what you have for a period. There are other factors associated, genetics, trauma, and other things that are, other disorders that are associated with it, but age is also an associate.
This age really assaults the body, seriously. Assaults every organ. But now enumerate some of the subtle signs and the consequences if ignored. Because sometimes these signs just come and then you just ignore it thinking that it will go away.
Like I said, one of the earliest things is the need for glasses. That is really almost universal. Quite a lot of people will get it. And then if you don't address it, then you begin to put strain on your muscles around your eyes, and you can start having Actually, some people develop some form of headaches, and because there's some of the muscles around the eyes here are connected to another group of muscles there, then you start having pain behind your head here, and all kinds of discomfort. And in fact, it could lead to you having so much. You could go around looking for a solution to probably a headache, and you go in for a CT scan, an MRI scan, and everything is just coming from your eyes. So it's always best to see a doctor early and then address what some of these things will come. So it's better you just you just decide that, look, let me face it, rather than trying to say no. You know, we like Nigerians, we say it's not my portion. But some things do come, and it may not be your portion, but you just try and address it early, so that you don't have unnecessary, like I said about the glaucoma. If earlier addressed, you are able to save yourself a lot of future problems.
Doc, we'll be right back. Don't go anywhere. We'll be right back. Welcome back. So, Dr. Femi Oderinlo, I heard somebody talk about high blood pressure in the eye. Is there anything like that?
Yeah, there's an entity called ocular hypertension. There's a pressure in the eye. In order for any sphere that exists must have its own internal pressure. Otherwise, the atmospheric pressure will collapse it. So in order for the eye to maintain its shape, it has its own inherent pressure. We call that intraocular pressure. So in some individuals, for certain genetic, or sometimes it could be as a result of post-traumatic changes or changes from inflammation, the pressures in the eye, they are higher than expected. So that entity is called ocular hypertension. It's a close relative of glaucoma.
Does age associated to?
Yes.
This age. So, doctor, let's recap what we can do to maintain a healthy lifestyle that will keep our eyes, well, not too assaulted.
I think one of the best things that anyone is doing is listening to this program because it helps you to understand things that can go on. And so first, you need to develop a good lifestyle. You need to eat well. I think that must have been emphasized before. You need to have good exercise, because your vessels, we can look directly in your eyes and see your vessels. And so a good lifestyle, there's nothing that can go except a good lifestyle. Then also, you need to check your eyes, because that's very important. I know a lot of people go through life without ever seeing an ophthalmologist.
Been there only once in my entire life when I got this.
Yeah, you don't have to come every time, but once, it's good to check your eyes, and then you'll be able to especially if there is a family history. And that's very important. If there's a family history of a disease, cataract, a family history of glaucoma, there's an increased likelihood. It doesn't mean it's not 100%, yes, but there's just an increased likelihood. So if there's a family history, that's something you really need to pay attention to. And like we also said before, good habits, use enough illumination. Actually, when you're watching a screen, it's always good to say 3 times the size of the screen.
Your length should be 3 times the size of the screen.
The size of the screen. It's not good health standing right in front of a screen watching it. So a good distance will be 3 times the size of the screen. So those are things that can help you at least take good care of your eyes. Do the one you can do, and
leave the rest for aging to take it.
No, for God to help you. And
Doctor, I want to say thank you very much for the information you have given to us. I hope viewers who have listened will put this into good practice, and will invite you from time to time to come and talk about specifics, like enumerate and discuss more on consequences of ignoring the subtle signs of aging and the damaging irreversible effects it can take and the toll it can take on us as we age. Thank you so much, Dr. Femi.
Thank you very much.
Thank you, viewers, and thank you for your time. And I believe you have been empowered with some information today on how to take good care of your eyes, because we will need it to see our children's children and our children's children's children. Until I come your way another time, my name is UD, and this is the UD Factor. You have a wonderful week ahead of you. God bless you.